In India, a number of health policies are announced every now and then, but when it comes to their execution, there is a huge gap between the vision and the reality. I have with me Dr. Peter Berman, who is professor at Harvard T. H. Chan School of Public Health. Dr. Berman has written extensively on the subject of designing and reforming healthcare systems. He has worked with the World Bank for several years, out of which he spent considerable amount of time in India. Welcome, Professor Berman.
Thank you.
So let me start with asking you about your work. In your work, you talk about three factors that determine the performance of a healthcare organization. Can you briefly talk about them?
Sure. So the three factors that I think you're referring to have to do with the environment in which these organizations work, the strategies that are used to affect or improve the performance of service delivery organizations, and the capacities or capabilities of the people who work in these organizations, but also the managers who oversee these organizations. And here we're specifically talking about the types of institutions that deliver healthcare services to people, so hospitals, health centers, clinics, subcenters, and so on. So first, the environment is critically important because this is what determines the parameters within which the providers in these organizations behave. And we're talking about primarily here about factors that affect behavior of providers. So what does the environment mean? It could mean things like the way in which people are permitted in their culture or organization to exercise autonomy in their work, whether they follow directions very explicitly, whether they're given some independence to decide what to do. It can be things as general as how accomplishments are recognized, or people, on what basis people get promoted, and so on. One of the issues that often comes up is whether there's really an open and transparent process for postings and transfers, or is that process somehow not objective and not transparent? So these kinds of environmental issues are critical. The strategies is really what I focused on in my work. And in the simplest terms, it's really fitting the right strategy to the right cause of problems in service delivery performance. So, for example, if we find out, let's say, that a certain group of health workers are not delivering services according to technical standard, they're not carrying out the right diagnostic tests, they're not asking the right questions in examination. So what do we think is the cause of that problem? Do we think they lack the knowledge and skills? In that case, training is the right strategy to address that cause. But perhaps that's not the cause. Perhaps they're not carrying out these tasks because they lack the motivation to do so. They know what to do, but they don't have any reason to do it. No one holds them accountable. Or they feel it costs them time and effort for which they're not being compensated. In that situation, training is not the right strategy at all. Some kind of incentive or accountability strategy is what is needed. So the second element, this element of strategies, is really about first identifying the causes and then fitting the right strategy to the right cause. One of the things we've learned in applying this kind of framework is that there's almost never only one cause. Right. And so it's really necessary to have a combination of strategies. And then the third element has to do with the capacities. So obviously, if you're going to need to understand what causes poor performance, you need to have managers and administrators who know how to ask those questions, who know how to find out the answers to what causes poor performance. So those capacities are necessary, those investigative or analytical capacities. But you also need to have the capacities to manage and administer the strategies. So if we're talking about, for example, training, we need to have training capacities. If we're talking about adding incentives to make health workers work better or smarter or whatever, we need to have the capacities to design the right financial or non-financial incentives and to manage the administration of those incentives. So those three things, the environment in which we develop strategies, picking the right strategies, and the capacities to deliver those strategies, all three of them are needed for an effective program to improve service delivery performance.
So if we focus on implementation capacities, especially in case of Indian healthcare sector,
Yeah.
the implementation capacity is quite poor for the hospitals and various policies and programs. So what are the specific areas you would identify in Indian context where India lacks in implementation capacity?
Right. Well, so first I would say that, India is a vast and complicated country, and I don't think we can at all say that there is a single set of problems. I wouldn't say that healthcare systems in India, either government or private, in a blanket sense, lack capacities to perform well. Some perform well, some perform better than others, and some perform poorly. So we first need to acknowledge that there's a lot of variability. And just to sort of be a little more specific, one often hears complaints about the quality of the basic health services in rural areas. But I think we have to acknowledge that many of the frontline workers who work in rural areas in India are doing a heroic job of service. They are being paid not terribly well. They work under very difficult conditions, and many of them continue to work year after year to care for their patients or the people they serve, but not all of them. So I think we do need to both praise the good work people do, but acknowledge the problems. So now, what are the causes of those problems? Well, they're different in different places. I think in some areas, health workers lack the basic infrastructure or support facilities or inputs that they may need to do their job properly. A health worker may be out in a health facility lacking the basic equipment they need to do a proper diagnosis, or being able to do a diagnosis and not having the drugs and supplies to do the treatment. So the solution in that situation is really trying to build up those support services. In other places, I think we see very high levels of absenteeism. People who are assigned jobs, they're hired and posted, they're paid, and they don't show up for work, or they show up for work only sometimes. In those situations, it's not a supply problem. It's a different kind of problem. It's an accountability problem. It's a discipline problem. Perhaps it's an incentives problem. And I think in significant parts of India, government workers have worked in environments where they're not held very accountable for whether they come to work. So I think this again comes back to this question of diagnosing the causes of the problem and then fitting the solutions to those causes.
Finally, let me ask you a question regarding the measurement of health outcomes. Measuring health outcomes is quite a complex problem for both the healthcare practitioners and the policymakers. In your view, what are the key principles that one should keep in mind while measuring health outcomes?
So that is a good question. And I think the first key thing to keep in mind is that there are different kinds of outcomes. And by outcomes, we mean the benefits that people expect to get from healthcare. There are different kinds of outcomes that matter to people for different reasons. People want to improve their health conditions. They want to alleviate pain, alleviate suffering, not contract dangerous or life-threatening diseases, and so on. People also seek protection from in the healthcare system from the high cost of healthcare. And this, what we call financial protection, is an important function of government to prevent people from falling into poverty from the unexpected high cost of healthcare. People seek a third kind of outcome from healthcare as well, something we summarize with the term patient satisfaction, but it actually means a number of different things. For one thing, it's a feeling of trust or confidence or security that people might get knowing that healthcare is available somewhere they know about when they need it at a price and in a way they can afford. There's also the satisfaction of being treated properly, of being treated with respect, and of having your privacy respected, and other characteristics of healthcare. So people seek those kinds of outcomes as well. Now, to make it more complicated, it's the three kinds of outcomes that I talked about are not measured by the same tools and instruments. So to measure health outcomes, one thing that we can make use of, which I think is a useful approach, is to measure something called effective coverage. So effective coverage means that the people who need a certain kind of health care receive it, that's the coverage part, and they receive it at a level of quality, technical quality, that is likely to produce a positive health outcome. So if we can find ways to measure indicators of effective coverage, then we can estimate the health benefits from care without having to actually carry out very costly and difficult population-based studies of changes in morbidity or mortality or something like that. On the financial protection side, again, it's a different kind of measurement is needed. We need to know what people pay for health care out of pocket, including their time and transport costs. And we need to have some way to benchmark this against their ability to pay, whether it's their income or assets they own or whatever. And we do have instruments for doing that. Satisfaction is one of the hardest things to measure. People don't often speak honestly and frankly about how they feel about it. And we also need to understand what their expectations are. But again, we do have instruments and things that we can use in surveys to ask patients these questions and to look at changes over time in satisfaction. So I would say to measure outcomes, first we should measure all three of these things. Right. Secondly, we should try to use instruments that are designed to fit with the context in India. And third, we should do this over time. So we should monitor changes. And I know this is a long answer, but I have to say that this is one area where I think India could do much more than it has done. I think that the programs have not often done an adequate job to monitor and measure these outcomes and how they change over time.
Well, thank you so much for joining us, Dr. Berman.
My pleasure.
Today, we talked about implementation capacity problems in India and how to measure health outcomes. It became quite clear through the talk that India is a vast and diverse country, which means policymakers have to study and customize healthcare solutions. This requires deep understanding of the environments, formulating strategies relevant to those environments, and procuring capacities to implement those strategies.